How do therapists determine lifting limits after surgery? Imagine trying to lift something heavy and feeling a sharp pain or discomfort. That's a sign your body needs time to heal. After surgery, knowing how much you can lift is key to a safe recovery. But how do therapists decide these lifting limits? It's not guesswork. They look at several important factors to keep you safe and help your body heal properly. First, the type of surgery you had is the most important factor. Different surgeries affect different parts of your body and have different healing times. For example, if you had abdominal surgery, lifting too much too soon can increase pressure inside your belly. This might cause your surgical site to reopen or lead to a hernia. Usually, after abdominal surgery, patients are told not to lift more than 10 pounds for the first 2 to 4 weeks. If your surgery was more complex or involved an open procedure, your restrictions might last longer, sometimes up to 6 weeks. The method of surgery also influences lifting limits. Minimally invasive surgeries like laparoscopy tend to have shorter recovery times. After these procedures, restrictions might be lighter and last only 2 weeks. In contrast, open surgeries often requiring longer restrictions, sometimes up to 6 weeks, because the healing process is more extensive. Your overall health and how well your body is healing also matter. If you have other health issues or your incision is healing slowly, your therapist or doctor might set stricter limits. They will check your progress during follow-up visits and adjust your lifting restrictions accordingly. That's why it's so important to keep all your appointments and share how you're feeling. Guidelines are helpful, but they are based on experience and common practice rather than strict science. Different healthcare providers might recommend slightly different limits. As new research becomes available, these rules can change. That's why your specific instructions might differ from someone else's, even if you had similar surgery. To help you follow these limits, your care team might give examples of what 10 pounds feels like. For instance, a gallon of milk, a small grocery bag, or a vacuum cleaner. Avoid carrying heavy items like laundry baskets, large bags, or children during your recovery. If you're unsure whether something is too heavy, it's always better to ask your provider or wait until you get the all clear. It's normal to feel impatient or frustrated with restrictions, but following them helps your body heal properly. Returning to normal activities should be gradual. Start with light tasks and only increase when your therapist or doctor says it's safe. Walking is encouraged right away because it boosts circulation and helps recovery without stressing your surgical site. If you accidentally lift something too heavy or experience pain, tell your care team immediately. They can check for problems and adjust your plan if needed. Remember, lifting limits after surgery are set to protect you and promote a smooth recovery. Always follow your provider's instructions, ask questions if you're unsure, and take your time returning to your usual activities. Your patience now will help you heal faster and stronger.